Thank you. I have nothing to disclose. The multiple array probe Leiden is an electromyography probe which enables assessment of muscle activity of the pelvic floor. And it enables differentiating between different muscle groups. The retest reliability was tested as moderate to excellent, but only amongst healthy patients. We aim to test the retest reproducibility in male patients with LUTS. This sub-study was part of an observational cohort study in which 57 men with moderate to severe LUTS were recruited. Amongst other things, MAPLe measurements were carried out at baseline and after 6 to 8 weeks, according to the manufacturer's protocol. 20 men were selected for the sub-study. All men had no measurement errors and received wait-and-see or alpha blocker treatment. We assumed that both treatments did not affect the pelvic floor function in between both measurements. The MAPLe assessment consists of 3 different measurements: a 1-minute rest, 5 maximum voluntary contractions, and 3 endurance contractions. The summarizing result of MAPLe gives 9 different outcomes, as you can see on the screen. The reproducibility was based on these 9 outcomes. To explain the statistics, I will take you straight to the first part of the results. First, we calculated the coefficient of variation, which is a descriptive statistic that reflects the variation between different measurements. And is preferable as low as possible, but at least under 20%. Next, we calculated the interclass correlation coefficients, which reflects the agreement between different measurements, and the higher the ICC, the better the agreement. Between 0 up to 0.5, it reflects poor agreements. Between 0.5 and 0.75, moderate agreement, and up to 1 is a good agreement. In this diagram, the blue bars reflect the wait-and-see group, and the red ones, the alpha blocker group. As you can see in this upper diagram, in this part of the diagram, you can see the results for the average microvoltage in all 3 measurements. In the upper diagram, you can see that the CV was quite acceptable for all 3 measurements. In the bottom diagram, you can see that the ICC was overall moderate. Next, you see the outcomes for the peak microvoltage and the onset time. In the upper diagram, you can see that the CV was overall quite high, and the ICC was only poor, so it reflects a poor agreement. And last, you see the outcomes of the offset time in both MVC and endurance measurements. For this outcome, for as well the CV and the ICC, the outcomes varied. In conclusion, our results show a poor retest reproducibility in men with LUTS. Although these results must be interpreted with caution due to the small sample size. Besides that, we are not sure if this result reflects a true problem with the MAPLe method or that other confounding factors are of influence here. Thank you.
Thank you very much. Any questions, please?
Hi, Selma. Hi, my name is Jeroen Vorm from the Netherlands, Leiden University. A small conflict of interest. I'm also involved in this product as a developer. So, thank you for this interesting independent research from MAPLe. I have a question about your how did the men do the assessment?
Yeah. Well, we had 4 medical students who did the assessment by all the participants, and they did it according to your protocol, and they received a training by MAPLe, by you guys, and they followed that directions and that protocol. So.
Okay, but if I'm correct, the probe was not always held in place, right?
No, that's correct. Okay. The probe was in there, and if they how do you say it? They
if
looked
it seems like it was in place, then
yeah, exactly. But if it was coming out, they pushed it back. But that was according to the manufacturer's protocol as it was delivered and approved.
And one other question is, was the patient blinded for the screen?
How do you mean?
Could the patient see what he was doing at the moment he was doing the rest, MVC, or endurance?
I have to look at you. No,
Sorry, no.
he was blinded, so he couldn't see the screen while he was doing.
Well, he was seeing the screen for the instructions as you provided in the MAPLe app.
So he was seeing if he was contracting and relaxing his pelvic floor.
I think the video shows the time frame for the contraction.
Yeah, and it shows the contraction itself. So I think what you actually showed there is, and you already kind of giving therapy, because you are feeding back what he's doing with his pelvic floor to the patient, and that's biofeedback. So it's not really an objective assessment of only the pelvic floor, I guess.
Would you guess that one session of MAPLe could have an effect after 6 weeks? Because the follow-up assessment was after 6 to 8 weeks.
Yeah, there is a steep learning curve with biofeedback. That's generally known.
Okay.
So that's my own, that's about the co-founding factors. About the problem with MAPLe, I agree that the onset and offset really have to be looked into.
Yeah.
Okay, I think we'll have to ask for one more question if there's any. If not, thank you very much.
Thank you.
I would like to invite the next speaker,